Hey, it's me. Welcome back to my channel. Toby licking himself. I want to do I don't know, a CF update kind of thing, about my lung transplant, and then also, I want to, mention and talk about this lovely new drug that I got. I already took my first dose. It's on my Instagram account if you want to, watch me do it, but it's not really that interesting. But yeah, I have lots of updates. Sorry, I have missed everything that's been going on, or not everything I've missed posting. This is the same shirt I wore in the last video. Oh well, whatever. But yeah, so I have obviously some good news, and I also have some other news. So I'm just gonna get started with it. Why is the lighting? It's probably just because it's so bright outside. So like I said, this past week I was in Philadelphia. Yeah, in Philadelphia for a lung transplant. Or no, whoa. Lung transplant evaluation. I did not get a lung transplant. But they were doing all the testing to see if I would qualify for one. And there's kind of good and bad news with that. So I'm gonna start with talking about that, then I'll talk about Trikafta. So my testing was Tuesday through Friday, or all my appointments or whatever. So Monday night, my brother and my mom and I, or one of my moms and I, went down up where, I don't know where Philly is. I think that's over. We went over to Philly, and we spent the week with my mom's cousin and her son, because they have a bigger house, and they had a finished basement, and they let us stay in there, and they had different mattresses. It was actually, really nice. I didn't feel, crammed, oh, they're letting us stay with them, but there's, no room. I felt, fine. So we got there Monday night. Tuesday, I'm trying to think of the test. I did this one test where I drank this stuff called barium. It's this white, there's two different versions. There was a thick one and a watery one, but it was the first one was very thick and heavy, almost kind of like paint. I guess that consistency, like acrylic paint. It didn't taste terrible, but basically what they did was they have me drink a sip or 5 sips or whatever, and they were doing x-rays and x-ray videos on to see how well I swallowed and if I had any acid reflux and stuff like that, because I guess one of the, give me 1 second to let him in. Hi, Banks. I guess one of the problems after a lung transplant, or even sometimes before, is that people have, what's it called? Acid reflux, stuff like that. And so when you get a lung transplant, sometimes it can be difficult to swallow and stuff. So I don't know. They were taking pictures and videos of that, which was fine. It was I was very anxious, not about the test, but just that was the first thing, and I also left my phone with my brother and my mom, and so, so when I got changed, and then I was sitting there for 45 minutes, and they had TVs, but they were both playing 2 different channels, but it was the same thing, because it was everything that was going on politically with Trump and the impeachment or whatever, and they were 0.5 seconds off from each other, so I could not focus, because it was they were saying the same thing, but it was really messing with my brain, and I was stressed. So I just sat there for 45 minutes and just kind of I don't know, dozed off and got anxiety. And then I did the test. They said that everything looked good. They did have to redo a few of them. They made me lay down and sip, like, on my side, and then they gave me a straw. I guess I don't know, like, what the purpose of that is, because I don't know when the heck I'm gonna be, like, sipping on tea while I'm laying down, but I don't know. So that all went okay. They were all really nice. I'm trying to think. Then that was like the main test for the day, and then yeah, then we had a lot of doctor's appointments, and then they did some blood work. and that doesn't sound like that would take all day, but we like my first appointment I think was scheduled for 8 in the morning. Oh, and I also couldn't eat breakfast, which also gave me anxiety because, not like terrible anxiety, but I have a certain number of calories that I'm supposed to eat during a day, and it's supposed to be a lot because I have CF, and so having to skip out on a meal does not do me well. I typically prefer home cooked meals because I know how much calories I'm putting into it, whereas if I just go to a restaurant, I don't feel like I either have to spend a whole lot of money to get the calories I need, or I don't feel like I'm getting the calories or whatever. So I didn't get to eat breakfast, and then we had to eat out because we couldn't like go home and eat and then come back, and so I was just getting very anxious all day. But after the doctor's appointments and just talking to the doctors, it was calmed down. It was fine. And so then the next day was, oh, this was terrible. The next day was the worst day, but I didn't expect that. And I don't know if that makes it better or worse because I didn't have time to get myself worked up beforehand, but they said that they were going to do like a breathing test and a urine test or something, or I don't remember, but they did. Oh, it was it was something, I don't remember. But basically, my brother's here if you heard him laugh. But basically, what the one test was that they did, which was the first one in the morning, they put this mask over my face, and it's like, it has oxygen coming out of it. Like, if you've ever been into surgery and you're about to get like anesthesia, they'll hold a mask close to your face with oxygen so you can breathe. It's that mask, except they have it right against your face, and it's very hard to breathe because it's pressed against your skin, and it felt to me like I was breathing almost like I was breathing through like a coffee stirrer straw thing. And like they told me beforehand, like, hey, it's gonna feel a little tight, you're gonna feel like you can't breathe, but you can, there's oxygen coming out of there, you're fine, but it's gonna feel a little bit difficult to breathe. But like I have problems breathing, so I'm expecting, I don't know, I was expecting it to be easy. Like, yeah, I've done this naturally before, so why should it be an issue? They put this thing over my face, and I'm just like laying there, and they want you to take, it was when they made me take deep breaths. They want me to take deep breaths, but you're taking the breath, and it's like, you feel like you're gasping for air. I felt like I was gasping for air, so I'm like, and then I started like, I don't know, just like freaking out, and like my whole like body started shaking, and like my legs were shaking, and it was more my legs. And then I like when I'd try to breathe out slow, because when I'd breathe out I was okay, but when I would try to breathe in, I felt like I couldn't take a deep breath in, and it would just like freak me out. And so like eventually like I just started like freaking out, and then I'm like, okay, like it's not gonna be very long. And then the lady's like, because she's holding it like against my face, and she's like, there were two nurses there, and she goes, oh, there's only about a minute and a half left or something. And like I'm like, what? Like, I cannot stand another minute and a half of not being able to breathe. And I started like freaking out, and I like pushed her hand off of me, not like hard, but I was just like, please, like, get this off, like I can't deal with this. And I just like started crying, and it was just like so dramatic and so stressful. And then she she took it off, and it made it a lot easier to breathe, so that was good. But like I just wanted it to be over, and she's like, I can't take it off like completely, but you're doing good. Like, they were being very reassuring and stuff like that, but it was not a good experience. And then after that was when they were doing whatever the other test was, but it was basically, I just laid there and then this like x-ray thing like went around me. But I was still like, it was nice that that was second because I had time to kind of relax. I was still like crying the entire time, but I had time to kind of compose myself before I saw my brother and my mom again, because I didn't want to like be like in the middle of whatever episode that was in front of anybody. So it gave me time to kind of calm down. Oh, I forgot to mention, on the first day after the barium test, when I went to change back into my regular clothes, I did like cry a lot just because I was stressed out. But the test itself wasn't bad or anything. It was just kind of like, it was just very real, like, oh, I'm going for testing for a lung transplant, and this is really scary. And I was also thinking a lot, too, during both of these tests. At some point I had to lay down, and I was just thinking, like, I'm doing okay right now because I'm on antibiotics, but, like, typically, like, this would be so hard for me, and, like, I don't know, it really, like, I was happy to be on antibiotics, but then I just got really scared because I'm, like, laying down is so hard, like, I don't know, it just made me think about a lot of things. So, those 2 days, I'm trying to think, so that was the second day with the whole, like, breathing thing, and then they did, like, a regular lung function test that I always get done when I go to the doctors. They also took blood from right here, wherever my pulse is, because I guess it can test the oxygen in my blood, like, before it hits my veins or something. Because it's like, it's an artery, or maybe that's not an artery, I don't know, but they were explaining it to me, and I'm like, whatever. And it, like, hurt, like, she numbed it, and then did it, and it didn't hurt, but then after she took it out, even before the numbness wore off, it just felt like, ugh, like, it was not a good feeling. And it stayed like that for, like, till the end of the day. And then she made me do this weird breathing test, which, like, okay, there we go. The breathing test was, like, it wasn't terrible, but it was just weird, and it made me uncomfortable, because, like, oh my god, they put me in this box, and then locked it. Like, it was, like, a clear box, and they put me in it, and they closed the door, and I'm like, And then you hear, and the doors latch shut, and I'm, like, sitting in this box, and I'm like, I can't get out. Which, not that it would matter, because I didn't want to get out, like, it's fine, but it just kind of freaked me out. I'm like, well, this is so dramatic. And then, they had me, like, breathe into this thing, and then, like, I'm breathing into, like, a mouthpiece type thing, and then, at some point, she presses a button, and it, like, puts a wall up, so you have to breathe really hard to breathe through it, and you're supposed to be, like, and, like, breathe really hard and, like, pant, and, like, I didn't like the test, but it wasn't terrible. And then they had me meet with a physical therapist to see how my muscles are in my body and all that kind of stuff. She was really nice. Actually, both of them, there were two of them. They're both really nice, I really liked them. And then my day was done. I went back home, or to my mom's cousin's house. And then the last, no, that was only the end of the second day. The third day, the only thing I got done, it was called a cardio catheterization. And, like, I don't know if you can see, yeah, there's still a little dot. So, oh my god, this is what I was anticipating to be the worst. Because they called me a few weeks before I even had any of my testing, and were, like, explaining, they were explaining the procedure. They're like, they're going to put an IV in your neck, and you're going to feel a little bit of pressure, but it's not going to hurt, and blah, blah, blah. And I'm like, oh my god, what? And, I was just, like, really nervous, and I couldn't eat this morning either, so I'm like, that made me anxious. And then, I was freaking out at first, because I didn't realize that that they would give you, like, sedation. Like, they don't put you under so you're asleep, but they give you, like, basically something so that you're just like, oh. But I didn't realize that, because nobody told me that. I googled it, and it said typically that they will sedate you for this procedure. And I'm like, okay, but typically doesn't mean always, and nobody's mentioned it. I was like, so I'm gonna hope that I get it, but I don't know. And then I went there, and the girl bringing me back to the room is like telling me everything, but doesn't mention the frickin' medicine or whatever. And I'm like, ah. So then I asked, when I got there was a nurse, and I like asked her, and she's like, oh yeah, and if you need more, you just tell them, they just give you more. I'm like, okay. And then that made me feel good. The procedure was really easy. What I was most worried about was it really didn't hurt at all. Like my neck, no, it's not too bad. It was a little sore for a day or two afterwards. But what I was most worried about was I thought, like, I guess because it's in your vein, you don't feel it. But they said you'll feel pressure, and I was picturing, like, if someone, like, I don't know, jabbed a stick inside me and was poking it, and you could, like, see it, like, poking on the inside of my skin. Like, that's what I was picturing. Because basically, I guess, what they're doing is they're checking something with your heart, and like the pressures, I don't really know what that means, but the pressures of your heart to make sure that, like, I guess you won't hopefully get a heart attack if you go for a transplant. I don't know. But I thought that I was going to be able to feel them moving around in there. And I wasn't able to. I could only feel what was going on my neck, and it didn't hurt. It was just like, they're touching or whatever. So it ended up being, like, perfectly fine, which was great. And then I had the rest of the day to do nothing. So I went home, or back to where we were staying, and cooked chicken and rice, which is like my go-to, and went to bed. Woke up, cooked more chicken and rice, I think, and went to bed. And then that was like my day. And that was great. And the last day was just doctor's appointments, so that was great. And then, so we were only there till noon. Like, the last day they were doing, it was, like, education, so they had, like, a class for everyone where they tell you, like, this is how we pick our donors, this is this and this, like, just kind of, like, basic information. And then, oh, that was my brother walking by. And then they had us talk with there's I think 2 different surgeons that do it there, and they had us talk with them, or with whichever one was working that day, and he like went through and told us everything and told us all the risks and all that kind of stuff. So now that that's all out of the way, for me specifically, I don't have exact results of my tests, except for my PFT, which I always get done when I go to the doctor. It's just like a regular thing for people with CF. You do a pulmonary function test. And that was pretty decent. It was, I want to say it was like 1.36 liters of air. And I think recently the highest that I've had is 1.39. So it's decent. I mean, a person my age, sex, and height is normally at, I think, 3.4 liters of air, so it's not, like, good, but it's decent for me, so that was good. All the other people that I talked to, like, I have a follow-up appointment in December where I'll sit down with my doctor, and she'll tell me, like, specifically the results and the numbers and everything. But the results that when I was talking to the people so far, what they've told me is like, oh, you seem to be doing pretty good. And like on the exercise thing, I got a 12 out of 12, which they said they like their patients to be, like, the people who are at a 12 out of 12 before transplant typically do better after transplant, because you have, like, your body functions good enough to survive the transplant. The swallowing thing, they said I looked good. I didn't seem to have any issues with anything. The heart thing, I think, was fine. I'm trying to think what else. Everything seemed to be okay from who I talked to. So, the pros and the cons of that. The pros is, okay, I'm healthy. Um, and I'm not healthy. If you compare me to somebody without CF, somebody my age without CF, I am not healthy. But, um, I'm healthy compared to people who need a transplant right this minute. Which I kind of figured because I can still function enough to work a little bit. I can still function enough to, like, move. Like, some people really are just sitting in a hospital doing nothing until they get a transplant because they're so sick and they're about to die. And I know I'm not close to that. Um, so while it's good that I'm not to that point, it's also, like, for me, it's a little bit frustrating because I still feel like my quality of life is so low. It's not the worst it could be because I still have moments or weeks or whatever where I can function pretty well as a human and as whatever. So yeah, I don't think I'm ready to need one right now, I guess. But it still kind of sucks cuz I'm in that middle ground where, like, I want to be healthy. Like, I want to be, like, normal or like someone without CF basically. Um and I can't be like that because I'm not sick enough to get the transplant to make me like that. So it's a little like, I don't know, but it's also good. Oh, they also made me do a walking test to see how well I could walk, which made me think a lot about, like, if I wasn't on antibiotics right now, I'd be on the floor. So, but I don't know. It's I'm happy to hear that I'm, like, on the healthier side of whatever. And they don't have to put me on the list just because I did the testing. The testing is to see if I'm a good candidate for the list. So that's why I have to go back and talk to my doctor. But it does kind of suck because, like, I would like to not have to only work 2 days a week. So, but I think the reason I know the reason that they are so whatever is they want you to be basically as shitty as you can be without being dead before they give you a transplant for a few reasons. One is it's not, like, super common, but it's not uncommon for people to die from a transplant, especially a lung transplant. Within the first month, I think 4% of patients die. I think. Within the first year, it's 10%, and within the first 10 years, it's up to, like, 50% or something. But granted, that does sound absolutely terrible. Like, wow, I have, flip a coin, in 10 years I might be dead. But, like, you also have to think the numbers that they're taking are from everyone who's ever gotten a lung transplant. Or maybe not ever, but at least in a certain time range who's gotten a lung transplant. But a lot of these people that are getting them, I think they said the average age of the people that they work on, or at least at that center, is 55. And so to get a lung transplant when you're 55, you might already have other conditions, like, whatever comes with, like, older age and stuff like that. And it's just, it's a lot harder on your body when you're 55 years old. And from what the surgeon specifically was telling me, CF patients tend to have the best results with lung transplants for a few reasons, because typically we're younger. So I'm 23 years old. That gives me a much better chance of, like, living afterwards. And also, we are very used to taking medicine at strict times during the day or whatever. We're used to a regimen. We're used to that. Some of these people, they don't take medication, or they might, like, a little bit. I don't really know, depending on the disease that they have and if it's treatable or not. But a lot of them aren't used to that, and so taking, like, their immunosuppressants is difficult for them, whereas for us it's like, yeah, I'm just gonna take it with everything else that I already take. So the numbers sound scary, but they're not as scary as they sound in my case. And so basically what he was saying was, I want you to feel like basically like your life is not worth living at all before you feel like this transplant is good for you, because you might die. And if you already feel like your life isn't worth living, or that you're not getting what you want out of life, then it's okay if you die. Kind of. That is very blunt and kind of like whatever, but that's basically what he was saying. And I agree, because like, if I'm like mildly okay, and then I do this transplant and die, like, that's really not good. But if I'm like, I'm living and but there's no point to me living because I'm not doing anything and I'm not whatever, blah, 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 then like, it would make sense that like, I mean, the worst that'll happen is I die and I'm still not, like it's how already, like I already feel almost like I'm dead. So, I go through motions where I feel really hopeless about my disease, and then there's other times where I feel mildly hopeful. Right now is one of the mildly hopeful times, but I think once it gets to the point that I am never hopeful, then I should maybe start pushing for this. So it looks kind of like this is gonna go on the back burner a little bit, at least for now, but they did say, like I said, I still have a follow-up appointment, and also, they did say that, it's good to have all this work done, because if I go into the hospital sometime and my numbers drop and they can't help me and I need a lung transplant, right then I already have everything sorted out, and they don't have to be like guessing and hoping and like doing all these risky things because they don't know what to expect. Whereas I have the workup done, I can redo some of it if I need to, whatever. So, yeah, so that's where I'm at with the lung transplant. The second thing, which I showed you in the beginning, is my baby Trikafta. I took my first dose this morning. Every time I cough, I'm like, oh my god, it's working. But then I remember that I have CF and that I just always cough, so maybe it's not the drug yet. But, this gives me a lot of hope. From the results in the studies, and from, there's also been, it got FDA approved about a month ago, and so I've seen people, like on, mostly on Instagram or sometimes on YouTube, who have been on it for a week or 2 weeks or 3 weeks or whatever, who got it sooner than I did, and like their results, it's like, it just like blows people out of the water. Like, I don't know, like every single person that I've seen, whether it's just from like reading the information on it or from actually being on it, everyone seems to be like, wow, like it's amazing. Not just like, oh yeah, I think I feel a little better. Like, people are really like, oh my fucking god, I feel cured. And it's not a cure, but like, it just like improves everything. So I think I've explained it before, I'm not sure, but basically what it does, it's 3 pills. I have the one that I already opened out there, but I'll show you. It's 2 in the morning and then 1 at night. And basically what it is it's a genetic modifier, I think is like the official term, I don't know, but basically the cells in my body don't allow salt to transfer through them correctly, and that causes me to cough. It causes thick mucus. It causes thick mucus in my lungs, in my digestive system, in my pancreas, all throughout my body, causes all these problems, and so my body is like slowly dying, and not able to recover because my body just keeps making all this thick mucus. But what this does is it makes my cells process the salt better, and because of that, the thick mucus becomes very thin, and things like digestion work better, things like coughing don't happen as much, and when, like right now, I have mucus in my lungs that's probably been stuck there for years, no matter how many treatments I do, how much antibiotics I do, because it's just like lodged in there, like it's packed the fuck in there. But this, once it starts working, my cells like start functioning and the mucus becomes thinner and all of it gets coughed out. So for the first few days that somebody's on this, you cough hysterically and basically cough up all the mucus that you've had in your lungs for your entire life. So 23 years of mucus is about to fall out of me in the next few days, which is going to be fucking nasty. But that's okay, because then afterwards, I'm going to be clear. I'm going to be hollow. And that's very exciting. So I think I can handle a few days of rough coughing. I took it maybe an hour or two ago. Not 2 hours, but probably more than an hour. And maybe it's because I'm talking so much. But I'm definitely more out of breath than I was this morning before I took it. So, who knows? If you're interested in watching me take it, I posted it on my Instagram, but I mean, it's not that interesting. I talk about the drug for a little bit, and then I go and I drink some water, and then pop the pills in my mouth. So, whatever. But, I'm really excited. This gives me a lot of hope. The numbers are incredible. People's lung function has been going up. I think on average it's 13%. And that doesn't sound like a lot, but when I'm sick, my lung function can be all the way in the low 20s, like 20% of what somebody my age, sex, and height should be. 20%. My lungs work a fifth of what they're supposed to. And then when I'm on antibiotics and I'm healthy, sometimes it goes up to 30 or maybe the high 30s, which still is about a third instead of a fifth. And that's rough. So, oh, my cats are just sitting there. I love them. But yeah, so that's crazy. And so if it goes, even if it just went up 10%, when I'm sick, that's almost closer to a third. Yeah, it is closer. That's closer to a third. Like, that makes my sick times my healthy level right now. And then it makes my healthy times, like, if my lung function went up 10%, when I'm healthy, I would have too high of a lung function to be on the transplant list at all. Like, this wouldn't even be a discussion. So I'm really excited to see how this works. And people notice results fairly quickly and within a month. Like, there was one girl that posted she was at 28% lung function. After a month on this, she was at 50% lung function. So, like, it's fucking insane. And not only the way that they can measure it is with the lung function numbers. Like I said, like how my numbers are normally in the low 20s or the 30s, like depending, whatever. That's how like doctors can measure it, to say, oh, this went from here to here. But also when you talk to people who have taken it, the way that they feel is just so much better, which is like more important than the numbers per se, because if you feel pretty functional and you're at 80% lung function, like, or something, like, whereas somebody else can feel, oh, I'm really sick, and they're actually at 85% lung function, like, it depends on you as a person, but because this clears out the mucus in your lungs, you don't get sick as often, because what happens is, like, I'm on antibiotics right now to clear out, all the bacteria, but there's all this mucus down in the bottom of my lungs and whatever that doesn't come out, and so there's probably still bugs in there that aren't being killed and aren't being like, whatever. So then when I stop the antibiotics, they just start to breed and grow again. But with this, it clears you out, and so it's very difficult for people, not difficult, but it makes it harder for people to be getting sick so often because there's not a space for the bacteria to grow because there's no mucus there, or there's less mucus. So people gain weight, or most people gain weight. Most people stay out of the hospital less. Some people even stop their insulin or maybe lower the amount that they're using, which would be so cool. Although I doubt I'm going to have to stop because the amount of carbs that I fucking eat in a day is crazy. But like it fixes, or maybe not fixes, but it helps all these things. And like, I don't know, I'm very hopeful, and I'm kind of just babbling, and this is a long ass video, so I think I'm going to be done. But I'm really happy, especially to get this the day after my 4-day lung transplant evaluation, where I was feeling anxious and feeling hopeless and scared because transplants, it's not easy. Like I said, people die. Like, you can have a stroke, you can have a heart attack, you can have, I think, like, the plasma bleed into your lungs, and you can basically drown to death. Like, crazy shit that's just, like, scary. It's a rough recovery. It's rough financially. It's rough because you have to rely on people, and I fucking hate relying on people. So, like, it's all these things that, like, maybe I will have to do it down the road. Maybe something terrible will happen and I'll have to do it in a month. But, like, from the looks of it, this kind of, like, at least eases my anxiety about the transplant for now. So I'm really happy to have it and start it, and I'm just, yes! Okay, done with the video.